In this episode of In the Loop, romantic comedies or rom-coms are a staple of the holiday season, and no matter how formulaic or repetitive they are, there's an explosion of them every year. We'll talk to the cast of a new rom-com about why audiences predictably flock to this genre during the holidays. Plus, a recent investigation from Newsy's documentary series In Real Life highlighted the abuse women have faced in the long-haul trucking industry. We'll speak to the producer of that piece to see how the industry has responded to their investigation. We'll get to those stories in a bit, but first, Americans in need of a little help from a hearing aid are finally able to get that help with a simple over-the-counter purchase, and that could have a huge impact for tens of millions of people in the U.S. In August, the U.S. Food and Drug Administration established a new category of over-the-counter or OTC hearing aids, allowing Americans to purchase the aids directly from stores or online retailers. These devices had previously required a medical exam, prescription, or a fitting adjustment by an audiologist, factors that made the process of getting a hearing aid a huge time and financial commitment. The OTC versions have hit the market in recent weeks and bring costs down from thousands of dollars to as low as just $200 at some retailers. Roughly 30 million people in the United States deal with hearing loss. That's a pretty big deal already. And data also shows only about 20% of those who could use a hearing aid actually tried to get one before this FDA decision.
Yeah, so this is a huge problem.
That's Dr. Ariel Fruint, an audiologist and co-owner of the audiology practice Pacific Hearing Service. She told us about how hearing loss can affect just about anyone. While the majority of patients are seniors or older Americans, it's not uncommon for younger Americans to experience hearing loss either.
And it is so common that every newborn baby in the United States is screened for hearing. And then also, across the lifespan, things can happen as well. Noise exposure, other health comorbidities can affect it. So we do tend to see more people who are older with hearing loss, but it really can affect anyone.
Dr. Fruint said that cost and access issues would keep people with hearing loss from seeking care for the problems in the past, which in turn could worsen their overall health.
Recent research has shown that there's a connection with hearing loss and other health comorbidities. So for example, heart disease, diabetes, and then also changes in cognition. And so it's really important that we treat hearing loss.
So while this expanded availability is broadly seen as good news for those in need of hearing aids, experts like Dr. Fruint say there are limitations and risks to these devices. First, the OTC hearing aids will not be able to help every patient experiencing hearing loss. So how do you know if you're a good candidate?
Over-the-counter hearing aids are great for people who have mild hearing loss on an audiogram. And so when we test hearing, we look at the softest level of sound that people can hear at different frequencies. And a mild hearing loss might mean that someone has difficulty hearing another person who is across the room from them or is wearing a mask.
But if you feel like your hearing loss is more severe and affecting regular conversation and your overall quality of life, you probably have moderate or severe hearing loss. In that case, you should seek out the help of a healthcare professional to get a more personalized hearing aid device.
So overall, our hope with the over-the-counter hearing aids is that more people who need care will have access to it and that people will realize what level of intervention they need.
Newsy national correspondent Meg Hilling tells us more on what people with mild hearing loss should know about their options when buying hearing aids over the counter.
Tuning in has gotten a whole lot easier for folks struggling with hearing loss.
Now there's this new pathway to care where people can buy products over the counter if they perceive they have a hearing loss without the intervention of a hearing healthcare professional.
Following FDA approval in August, hearing aids have become available in places like Walgreens and CVS without a doctor's prescription, giving the hard of hearing a choice that wasn't there before.
Cost is one barrier that stops people from getting hearing health care. Another can be access to the care. Not everybody has access to an audiologist. And sometimes it's stigma. People think hearing aids are just for older people.
But with this new access to care has come questions, which has prompted the Hearing Loss Association of America to offer some guidance.
It's really important to remember that over-the-counter hearing aids are only for adults with self-perceived mild to moderate hearing loss. So if somebody is considering it over the counter, it's really important that they look at things on the box. First of all, it should say over the counter hearing aid, which means that it has met the FDA regulations.
As for finding the right one,
first of all, your brain has to adjust. You're getting bombarded with all these sounds you might not have heard before. So a return policy is really important.
this is where health experts become a bit wary of over-the-counter hearing aids.
Some hearing aids are like race cars. You need a good mechanic for it to run well.
Dr. Elias Michaelides says that fine-tuning is essential for them to work right. While over-the-counter hearing aids may be more convenient for patients, audiologists warn that it's crucial you make sure the underlying source of the hearing problem is addressed, citing concerns that their use could lead to symptom masking.
My philosophy is that if you do have some hearing loss, it's a good idea to get a full hearing test so that we can diagnose if there's any treatable conditions or any serious conditions that might be causing the hearing loss. We can see problems with the eardrum, like a hole in the eardrum, but we can also see chronic ear disease. We can see inner ear tumors and other conditions that might be treatable either with medications or surgery to restore the hearing.
Regardless of the route chosen to address hearing loss, advocates say the very fact that conversations are being had is a step in the right direction.
The important thing is that people should pay attention to their hearing health. It's part of overall wellness.
Meg Hilling, Newsy, Chicago.
All right, many thanks for that reporting, Meg. We're going to take a quick break, folks, but before we go, we want to flag one last thing for viewers who might be experiencing mild hearing loss and considering OTC devices. Remember to keep up with the maintenance.
Because a lot of times hearing aids can sound great at the beginning, and then after a couple of months, if they don't have routine maintenance, if no one's looking in the ear to clean it, if no one's cleaning the hearing aids, it can stop working, and then the hearing aids end up in the drawer.